Can psychological stress cause bladder irritation symptoms? Imagine feeling a sudden urge to go to the bathroom or experiencing discomfort without a clear reason. Many people wonder if stress could be behind these bladder issues. The answer is yes. Psychological stress can influence bladder health and may cause or worsen symptoms like frequent urination, urgency, incontinence, and pelvic pain. Scientific studies support this connection, showing that stress impacts how the lower urinary tract functions. When you are under chronic stress, your body responds by releasing chemicals called cytokines and chemokines. These substances trigger inflammation, which can affect the bladder both locally and through the nervous system. Inflammation in the bladder tissue can make the bladder more sensitive, leading to symptoms of irritation. At the same time, stress-related changes in the brain can interfere with how the bladder is controlled, especially involving a neuropeptide called corticotropin-releasing factor, which is linked to stress responses. Research involving humans shows that people with overactive bladder often report higher levels of anxiety and stress. These psychological factors tend to make urinary symptoms worse and increase bladder sensitivity. Life events that cause stress or anxiety can sometimes come before the appearance of bladder symptoms, suggesting a two-way relationship. This means that stress can both trigger and intensify bladder irritation. Animal studies also support these findings. When animals are subjected to stress, their bladder nerves and behavior change in ways similar to human bladder irritation. Some experimental treatments that block stress-related pathways, like certain receptor antagonists, have shown promise in reducing stress-induced bladder problems in animals. Although these treatments are not yet common in clinical practice, they highlight how stress management could help improve bladder symptoms. Understanding the role of psychological stress in bladder health is important for managing symptoms effectively. While stress does not cause bladder cancer, ongoing inflammation and irritation from stress-related mechanisms can contribute to other bladder conditions. If you notice bladder symptoms alongside feelings of stress or anxiety, it is wise to consult a healthcare professional. They can help determine the cause and recommend a comprehensive approach that may include both urinary symptom management and stress reduction techniques. In summary, chronic psychological stress can influence bladder function by promoting inflammation and altering nerve signals. This can lead to irritation and symptoms like urgency and pelvic discomfort. Recognizing this connection encourages a holistic approach to bladder health, emphasizing the importance of addressing both physical and emotional well-being. Always seek personalized medical advice to find the best treatment plan for your individual needs.